So let's talk a little bit about utilization management. Utilization management, not something new, something that we've been doing in healthcare for as long as I've been in healthcare. But there's a lot of room for improvement, and CMS is really ensuring as part of their final rule for that was just in January 2024 around the interoperability and prior authorization. That final rule, making sure that we really improve utilization management. It's really designed to be able to improve that exchange of information when an individual is seeking care and whether or not that care is going to be approved or denied. And it really also focuses on the part on the APIs and part on the member experience by enforcing, yeah, stricter timeframes that are coming, and increasing the overall transparency of the utilization management process. So who does this final rule impact? Well, quite a few. Medicare Advantage across the board, state Medicaid, the CHIP program, fee for service, Medicaid managed care plans, and then QHP as part of the federally facilitated exchanges as well. So uh, quite a few across the board this rule impacts. There's a couple of different pieces of it. The effective date for the first piece is January coming up here. I know it seems like it's not really coming up here, but I can't believe it's already the end of April and it'll be here before you know it. So timeframes and denial reasons to providers and patients have to be, as well as publicly accessible reporting metrics, and we'll talk some more about this. And then in January of 2027, there's APIs that are required in order to be able to provide prior authorization information back to both providers as well as to members. So two pieces of the changes that are coming for utilization management, two different timelines that those will go into effect. So, some of the trends and really assumptions is that moving more and more towards the electronic exchange of healthcare information. And so this step with the APIs is really starting to move that forward, as well as really aligning the push for more transparency with members and between the healthcare entities. And probably, I think maybe one of the most important things in here is reducing delays in care. Right, and the numbers that we have as far as estimated utilization management is to save around 15 billion over 10 years. So what are the implications? There are implications for us. There's the investments that's going to be required around operational processes and technology required to meet these new requirements, as well as the APIs from a data exchange perspective, faster turnaround times, which we'll talk about, reporting transparency and measurements.